Hello, everyone. I'm the director for our New Zealand registered not-for-profit charitable educational trust, Common Knowledge. And I'm going to continue on this You in Childbirth series, and today we're going to talk about breech births. Because on Facebook, that's an incredibly hot topic. There are several breech groups and as well as VBAC groups and natural birth groups. But let's talk about breech births. As I say in the description, when I gave birth in 1970, if you had a breech baby, you labored and had a vaginal birth. It's as simple as that. That was considered to be a risk. Risks were considered to be normal. The medical profession wasn't as sophisticated. Cesareans were major abdominal surgery. If a baby died, there wasn't any real birth control. Women had more children. And if you had a tragedy, people grieved with you, but by and large, most people didn't have a tragedy. Most babies, there were breech births. They were often, doctors had the skills to do an internal version, or they used an episiotomy and forceps. And why did they use that? Let's just get that out of the way. Because women haven't known how to prepare their body for birth. So many, too many women have tight crotches when it comes to birth. And so if you have a big object the size of a grapefruit that's trying to come down out the soft tissue of your vagina and it's tight, it then will stop the baby from being able to open the last of the vaginal opening and be born. But it's more important than that, which is what Birthing Better families discovered in the 1970s as they developed the skills. If the tissue of our vagina, and that's all of it, so when you're sitting there listening to me now, and you're sitting on a chair, the tissue is between the bones you sit on. It's between your vagina and your tailbone. But mentally go up inside. It's between the bones you sit on inside and the muscles that run up on the back of the inside of the vagina to your sacrum. And then there's the bony structure that has soft tissue around it. And then, as you sit down, you also have muscles that are behind your rectum. And that area, your sacrum and the muscles behind your rectum, are what your baby has to move out. And if it's head down, it moves it out to turn the corner to come under the pubic bone to align with the vagina. Or if it's a breech baby, the last part of the baby that's going to come out is the head. And if a woman's sacrum is compressed, like sitting on her sacrum to deliver, or she has tension inside her vagina, or she is in a position such as squatting with her legs out to the side that contract those muscles, or standing and contracting those muscles, or she's in a position like hands and knees where the baby falls forward and then has to do this phenomenal shift to come under the pubic arch. If that sacral area from the inside and all of that soft tissue that is in the top of our vagina, if that is tight and we fix or lock our sacrum, then our baby's head is much more likely to be retarded, delayed, or stopped. And that's the greatest risk of a breech birth, is the head doesn't deliver. It's trapped. And it's trapped because we as women, throughout time and place, didn't really know that we had skills to prepare our body specifically, or skills to cope or manage the hard work of labor. And so we as women have lacked a huge component of our life, which is how to prepare our body to deliver our breech babies. Does it make a difference? Well, yes, it does. So you can just do that and pretend that's tension in your vagina, and then just try to get an object through that. That's hard. Okay, that's hard. It's tight. So what if I just soften? What if I just soften? What if I just soften? Then that happens. So it's very important that you understand that There is no societal message to you at all that you need to prepare your body for birth or learn skills to cope with the natural occurring pain of labor. None at all. None at all. None at all. And doctors have lost some of those skills. And partly, no, I don't want to say partly, to a large part it's due to us as women. My generation particularly, because when I gave birth in 1970, the medical profession was not very sophisticated in terms of childbirth. 95% of us labored, whether we had a good birth or a tragedy, whether we coped or suffered, whether we labored for hours or days. So the medical profession the maternity profession was quite new. The obstetrical profession developed in the 1950s, my lifetime, quite new. And cesareans were major abdominal surgery. But my generation of women, started to wear bikinis, which you think have always been there. They weren't always there. It was considered to be obscene for women to expose their body. And when we started to wear bikinis, we demanded not to be left with the ugly scar of a cesarean. So the medical profession came up with the bikini cut. You've probably laughed and thought, oh, what a funny name. They didn't invent it. We wanted not to be left with an ugly scar. We also wanted to have VBACs. And so it was safer for them to separate the lower fibers of the uterine muscles than to cut the long fibers of the upper uterine muscles, so we could more safely VBAC. And instead of knocking us out, they could give us a spinal or an epidural, which permitted our husbands to come with us. And my generation of women, didn't want our breech babies to be put at risk. We didn't want our twins to be put at risk. We didn't want a lot of risks to threaten us or our baby. And so we demanded, as we always have, for the medical profession to come up with things that reduce or prevent risks. And the medical profession does it in the way they know, through their methods. But what was interesting was at that time, there was only a skills-based approach to childbirth in the first childbirth preparation classes ever taught. They were Lamaze and Bradley, and in New Zealand, where I live, Grantley Dick Reed. So we all learned skills in the United States, multiple millions of us, which meant that we reduced our suffering, not by 90%, easily, because we coped better. But reducing suffering doesn't mean that we're reducing risks. So you need to understand that skills were very highly prized in the 60s to the 70s. And then the voices in the natural birth movement poo-pooed the skills and said they're not achieving, for low-risk women, this ideal birth, natural birth, pain-free labor with no medical interventions. So they shifted over to choices and birth plans and say no to medical care. And so breech births were still happening during this period of time. There was pressure on the medical profession by us to reduce risks, and to make cesareans safer and not leave us with an ugly scar because we were wearing bikinis. And so we wanted to reduce risks. So we said yes to more medical intervention. At the same time, the natural birth movement was saying no to medical intervention and that birth was natural. But this is where the problems became, particularly around things like breech births. Is a breech birth normal and natural and physiological? Yes, it is. It just is. There's no and, if, or but. It's not a variation of normal. It is just normal. It's just normal. And why are some babies breech? Well, sometimes women have a slight partition in the uterus called a septum. And so as the baby grows, it just grows into the area of the uterus that it can grow into. And sometimes it just is head up. Other times a woman has had a number of children and her uterine muscles are quite weak, and so are her belly muscles. And so the baby can float around in there and just ends up in a breech position. Sometimes it's actually the shape of the woman's bony pelvis that predisposes a baby to get into a certain position, as well as a breech position. So we don't know where the placement of the placenta is. We don't know how long the cord is. We don't know other factors. So breech baby's normal. This is just normal. Twins are normal. Having diabetes is normal. It's all natural, normal, and physiological. But the other reason that the medical profession started to change from when I gave birth in 1970, and pretty much all breech births were vaginal births, and when doctors were doing internal versions, which could cause a problem, they were doing episiotomies, which the natural birth movement didn't like, and they were using forceps, which the natural birth movement in the 90s was saying was causing damage to babies. And it was. And when they coupled, let's not use forceps so much, and made it safer to have cesareans, and made it easier, then doctors and women chose cesareans rather than risking a forceps birth. But nobody addressed the fact that we had tight crotches. Nobody's addressed it. Even the perineal massage is just a tiny little tissue between the vagina and the rectum. That doesn't have anything to do with those deep muscles that cause the sacrum to either be mobile or fixed. And if the sacrum is fixed, it is harder for the head, unless the baby is quite small relative to your bony pelvis, you can fix that head. And then you, without knowledge, you or your birth professionals put that baby at risk. So if you're tight in there, you put your baby at risk. Is that guilt tripping you? No, it's telling you there is no societal message at all that you need to prepare that part of your body sufficiently, particularly if you're pregnant with a breech baby. There's none. There is no societal message. In fact, there's a very well-known breech group, and there are videos all over the internet and all over YouTube about breech deliveries. And often, those breech deliveries are in positions that actually make it harder for baby to be born. And that's the hands and knees, or adducted squatting. And many of those progressions of labor, although some of them the baby is fine, very, very, very retarded. We don't want that. We want our breech baby to move down through and out our body. So right now, what's happening with people who are pregnant with a breech baby? First of all, they're absolutely panicked. Because remember in 1970, you wouldn't have remembered, you weren't there. We didn't have ultrasounds. We didn't have continual fetal monitoring. We didn't have women who were so risk averse. We accepted the risks, and we did accept the tragedies. We didn't like them, but we accepted them as part of life. Now, nope. And now, a death in birth is considered the worst type of infant death. But talk to anybody who's lost a 12-year-old or even lost a 20-year-old, or the people in COVID now, the grandparents who've lost their sons or daughters to COVID. Every parent wants their child to outlive them. So we're all trying to avoid risks. So now on the breech Facebook pages, you hear women saying, I'm 27 weeks pregnant, my baby's breech, and now I'm going to stand on my head trying to get into an optimal fetal positioning. This is helicopter pregnancy. This is in a panic mode all the time because we're hearing mixed messages. Is breech normal? Is breech a variation of normal? Is breech a risk? Breech is normal, and it has some risks. If your breech baby is also a twin, then you have a twin risk as well as a breech risk. If your breech baby is small and you know enough how to map your bony pelvis and you think, oh my God, a freight train could get through that, there's probably very little chance that your baby is going to get stuck. If your baby is snug or big for your body and you do not know how to open your body, nor do you know how to assess whether your body internally is tight or whether you can mobilize your sacrum or create space between your hip blades. If you don't know what positions keep your labor being effective and progressive compared to your labor backing off and being ineffective, then without intent, you are adding risks to what is a risk. So right now on the breech Facebooks, you're all trying to turn your baby into what you consider to be an ideal position. Head down baby has risks. You need to understand that. Pregnancy and birth has higher risks than not being pregnant, not giving birth. Neither of them have higher risks than living. We don't get out of life alive. We are more likely to die from being in a car accident. Our breech baby is more likely to die from choking on something or a household accident. So we now are narrowing things down. We're pregnant. We have a breech baby. We consider this to be a risk. And we put the word risk in neon capital letters. And because there's no societal expectation for us to prepare our body to let this big object out, we don't know what to do. So we're going to chiropractors who do Webster technique. We're doing optimal fetal positioning for hours. We're trying to find good supportive breech care providers. Some of them will encourage us to get into positions that actually hinder the delivery of our breech baby. We're trying to make choices. We spend hours being anxious. We go to a doctor and have another ultrasound. We're scared, we're frightened, and there is no societal expectation that we should learn skills and know how to prepare our body. So if you want to prepare your vagina, then it's not hard. So first of all, your partner can do it because they're approaching it that way, right? And all they have to do is to go in with one finger and just feel inside where your tensions are. Feel that space. Your partner can imagine a grapefruit's coming out and feel that space and find out where there's tension and then gently massage that tension. And to do that 5 minutes a day for 8 weeks, from 32 weeks onward, is that odious? Compared to all of your mental angst, is 5 minutes a day for 8 weeks odious to make certain that all that tissue inside your vagina is soft and pliable, including the vaginal ring? Is that hard to do? No. It's easy to do. You just never were told. And is it an enjoyable sensation? No. When you're softening tight muscles, that can be tender, but your birth hormones come into play, and within 2 weeks, it begins to soften all those muscles from your sit bone to your sacrum, all in the back of your rectum, all along each side of your rectum, the vaginal opening, every place. If you soften that, oh, you say you don't have a partner to do that. That's not a problem. We're built to be able to do that ourselves, and we do it with our thumbs. We have 2 thumbs. Right? And women think, I've got a big belly. I can't get my thumb in there. You're wiping yourself, right? You can get in there. You just need to have the skill to do it. So I'm going to show you how to do it. Okay? You have a big belly. So make a decision which thumb you want to use. Okay, I'm going to use that thumb. That means I'm going to lean over this way. And that gets my belly out of this arm, which means I can easily put my thumb into my vagina on that side, and then between my thumb and index finger, work all the way back up. We can reach all those muscles. We can reach them 5 minutes a day for 8 weeks. Is that hard? Is that a lot to ask, given how much time you're suffering with anxiety about it? We hear women all the time say, I don't have time. And we ask them as a trust, when your baby's born, are you going to have time? Oh yeah, of course, I'll have plenty of time. Your baby's here now. You want to have a breech birth, and your baby is in a normal position, which happens to be breech, and there are some risks involved in it. Do you have time to spend 5 minutes a day for 8 weeks doing this? Ah, you say, now I've done that. She's almost talked for 5 minutes. So now, what do I do? That? No, you don't. Of course not. Put your other thumb up. Put your belly over to the other side. Get into the other side and work that and work that and work that. All around the back of your rectum. All the way to those muscles between your tailbone and your lower sacrum. Your lower sacrum all the way to the sit bones. As far back as you can. Because when you look at a pelvis, just go find a pelvis. Look at a pelvis and look into it. There's a mouse's head in there. Your tailbone, and then all those muscles here Those are the muscles that if you get them to mobilize, your baby can then move your sacrum. Those sit bones, how far apart are they? Can a grapefruit fit in them? Your vaginal opening to your tailbone, can a grapefruit or your fist fit through there? When you stand up, how does that change you? Does that bring you closer together? How do you stay open down there for your baby? Can you mobilize your sacrum in any position? If you're sitting down now, where's your sacrum? It's at the end of your spine. It's a triangle. So just try tucking your tail and then try moving it back. That's mobilizing your sacrum. And when you tuck your tail, you're mobilizing the top of your sacrum to the inlet of your pelvis. And when you put your tailbone out, you're mobilizing and opening the mid and outlet of your pelvis. And then you have to soften in those muscles in that mouse's ear and open up around your rectum. Can you see how that would let a bigger object out? The final part of your breech baby, the head. And one more thing, I just want to tell you, because, when we developed these skills 50 years ago, we were developing a time where no women had choices. And however our birth professionals dealt with us, they dealt with us the way that they dealt with us. Mostly we birth lying on our back. And if you think that's the silliest thing in the world, get on your back, put your feet up in pretend stirrups, and you'll notice you're very, 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 very open. Now sit back in a semi-recumbent position. Notice how you lock your sacrum. Now get on hands and knees and notice what happens to your sacrum, and that your baby has to fall forward and then come out and round that corner. And try mobilizing your sacrum independent of arching your back. And would you remember to do that? So you need to understand that we have an issue. Our biggest issue is us, because there's no societal message at all that we should become skilled and heighten our skills if we're pregnant with babies that might be a risk. But then think about the care providers you're choosing. The theory now is hands off a breech. So I want you to go and watch some breech births on YouTube. And I want you to watch something when there's hands off. I'm not an advocate of hands off or hands on, but I'm going to tell you what we see as skilled people. When you have a funnel, which is your bony structure, that your baby is coming through, it is pretty much a fixed object, except the ability to mobilize that sacrum and a hip lift. But most of us aren't doing that then. So you have a breech baby that comes down. So let's say its arms are up above its head like this or like this or like this. Doesn't matter how it is. And maybe it's got a foot up there too, or 2 feet up there too. And that baby comes down into the funnel of that bony structure. And some of it comes out of her vagina. And people hands off it. That jams that baby in the funnel. It makes it harder for our baby to do anything. Now, what people say is, well, the opposite is that you pull the baby out. No, there's not an opposite of pulling the baby out or hands off. What you need to do is to recognize the common sense of this. When that breech birth, part of it is delivered, just support that baby. Take the pressure off the bony funnel. Just gently lift that baby up and let it move. Because breech babies, like head down babies, they can move if there's space for them to move. This is true of shoulder dystocias as well. The shoulders are stuck in the funnel. So you need to ease the pressure off the funnel. And you do that by supporting a breech baby, letting the baby move, and having the upper part of the woman's body aligned to the lower part of your body, and making certain we who are birthing, then are softening in those mouse ears, softening inside that vagina, and getting into a position in which our body stays open and is not being compressed. So how can we now resolve all of this? As the director of the trust, for 50 years, because the fathers and mothers who developed the Birthing Better skills and the concept that was broader than the Birthing Better skills were simply saying that when you're pregnant, it's normal and natural to self-learn birth and birth coaching skills and then use those skills when you work through the activity of birthing your baby. That concept was resoundingly rejected in the early 1980s by people who felt that skills from Lamaze and Bradley and Grantley Dick Reed were only focused on low-risk women to achieve a natural birth, a pain-free labor with no medical interventions. And not enough women achieved those narrow goals. No kidding. But multiple millions of women in the United States for a generation, and fathers for a generation, reduced their own suffering. We coped better, we managed better, we worked through the activity, the hard work of labor, because all of us pretty much were doing it back then. But we didn't know how to prepare our body. So the concept still holds. And as a pregnant woman now, there are skills-based methods out there. Self-learn them and commit to using them as you work through the activity of birthing your baby, no matter how that unfolds. But you also want to look for skills that prepare your body to open up for this big object. And that's something that Birthing Better fathers and mothers did. We realized that a delay in first or second stage led to more interventions. And so if we could open our body, make our body soft inside in the last 8 weeks of pregnancy, make mobility inside our body consciously, then we'd help our baby. And then during the labor, if we could make certain that we were not compressing the baby's space by sacral pressure, or by sitting on our sacrum, if we could get into positions that our contractions were effective, they'd start, the intensity would rise, they'd have a defined peak, they'd start to go away and go away, rather than to start to go up and plateau off and then ease off. If we could have effective contractions for every contraction, our baby was telling us there was no tension inside. The positions we were in were permitting the baby to open us up, come down through and out. So for some women, even bending forward can back the labor off into a plateau contraction. Hands and knees backs off the labor for many, many, many women. But it eases the intensity of the pain, and women are pleased for that. So they go for less pain for themselves and hindering the process of birth for their baby. Adducted squatting, it just fixes the sacrum. It makes it harder for the baby's head to come down. Asymmetrical squat is good. Be on one knee and the other foot down so that you can open that space. Or sitting on one sit bone with your leg tucked in front of you and the other with the foot down so you can adjust that space. You, as a pregnant woman having a breech baby, you need to be able to assess how your baby is moving down through and out your body. We have to stop listening to those people who say walking is best for birth, and then you walk and end up with a cesarean. If you feel tight walking, don't walk. If you hear being on hands and knees is good for a breech birth and your contractions plateau off, get off your hands and knees and get into a position in which your contractions have a peak. Your baby is telling you it prefers that position. Your breech baby can deliver safely. There are risks. You need to know your body. You need to know what your pelvic map is. You need to know what your distance front to back, side to side is. You need to know that. That's the shape your baby is coming through. You need to know how to soften inside, make your pelvic bones mobile. Right? You can do this, and there needs to be a societal expectation that you do. And if you're a birth professional, you have a responsibility now. There is not going to be a rising up of women. They may want to make choices and want to maybe get more birth providers out there who can deliver breech births again. But you're setting yourself up for a trap if you're working with unskilled women. Honestly, they're relying on you. And what happens if something happens? They put it on you too. Pregnant women are grown adults. After the birth, we're going to be a mother or a father. We have the capacity of self-learning skills, and it should be expected of us. And as a birth professional, just say that. You're going to do the activity. Here's a handout of all the skills-based methods I know. Self-learn some skills from 24 weeks onward. We're going to just keep a record of the skills you're going to learn. You're going to prepare your birth canal from 32 weeks onward. And every skill you've learned, great. That's going to be alongside all your choices. And when it comes to the birth, if your choices unfold, yippee-skippy. If they don't, we're going to try to involve you in the decision-making. If you look like you're coping, if your birth is moving along, we're going to praise you for showing that you are doing this activity in a skillful manner. If you looked overwhelmed, or if your labor looks like it's stalling, we're going to go back to your notes. Are you using your breathing? Are you using your relaxation? Are you using the skills you've learned to know what positions keep your contractions progressive? And we will encourage you to use those skills. As a birth professional, you have a responsibility to our society. Now, our New Zealand Charitable Trust Common Knowledge will work with anybody. We will work with anyone. For 25 years, from the 70s to the 90s, I tried to pass on this concept that it's normal and natural, that when you're pregnant, you self-learn skills and use those skills to birth your baby, no matter where you birth, who's present, what your circumstances are, your beliefs, your choices, your lack of choices, your change of choices, or what happens to you at the birth. Because that's what fathers and mothers asked me to pass on. That's how they acted. That's their behavior. That was how they birthed their babies, using skills. Did they all have perfect births? No. Did some have tragedies? Yes. So I stopped. Then I moved. Then I tried again. Because I moved to a country that had a midwifery partnership. And the midwifery partnership rejected the concept. And they still reject the concept. So if you want birth to change and you want a strong partnership between us as birthing women and you as birth professionals, you need to want us to become skilled. And there's no societal message for us to become skilled. And we're spending all our time trying to turn our breech babies. We're spending all our time trying to find you as a care provider. We're spending all of this time doing all these other things and not learning how to prepare our body or how to cope with the natural occurring pain, or how to make certain that our breech birth is an effective, progressive labor. And that's the gap. And that gap is huge. And that gap is holding the childbirth conversation back. Both of us get to change that. We as pregnant families and we as birth workers. Together we can do this. Within a very, very short period of time, if you're a birth worker, it will take you less than a year to get your clients to self-learn skills. Just give them a handout of skills-based methods you know. Take them a year, but follow up. Make certain that when you see people in birth, that they are behaving, coping, managing, working through, dealing with, handling, staying on top of, and feeling in control to some degree. Stop accepting moaning, groaning women as though that's natural. That's natural when women lack skills. And then work with those breech women. Talk to them. Is this position keeping you open? Soften inside. Is this position giving you an effective contraction? And make certain that when that breech comes out, that you gently support it so it doesn't get wedged into the funnel. I've had my say today. Will anybody listen? Will anybody act? How can you support our trust? Like our Facebook page, subscribe to our YouTube channel, donate to us. I spent 50 years of my life carrying forward a message that fathers and mothers asked me to do. Have I been happy to do it? It's hard work. So is being pregnant, so is giving birth, so is being a parent. So this happens to be the work that I do. Do I need you to participate in this work? Yeah, or I'm just talking to avoid. We have to change childbirth conversation. We can change it around breech births. We can change it around all births. So thank you for listening. Bye-bye.